So many women are like, I'm really tired. My hair is falling out. I'm cold. I'm in pain. My brain is foggy. Fill in the blank, a female experience.
How are you going to out coffee or out sleep a mineral deficiency? How many divorces have happened because of iron deficiency?
Hospitals don't give a That's the problem in the first place. And just because the system doesn't emphasize this doesn't mean it's not a big deal. Okay, so we're talking today about iron. You might be like, this is going to be the most boring podcast episode ever. And it's actually not. It's one of the most riveting things that we think are as important for us to talk about. And Paul and I have been training like a whole bunch of doctors, almost like 200 doctors and other people to like offer iron infusions. It's become a huge part of our practice. We have a bunch of clinics that offer them. So it's a big deal for us, and we kind of want to explain why it's such a big deal and why you should pay attention to this kind of Okay. I want to talk first about like why there's a problem in medicine with who gets to be told they're iron deficient. There's this issue that we have that so many women particularly are like, I'm really tired, or my hair is falling out, or I'm cold, or I feel like I'm in pain, or my brain is foggy, fill in the blank, a female experience. And they go to usually a doctor and they're like, I have all these problems. You're supposed to help me. The doctor runs a bunch of labs and says, okay, let's figure this out. We're going to house the shit out of you and we'll figure you out. And then they either never hear back from their doctor, like ever. They cannot get a text back at all. Or they do get a call back and they're told everything is fine. Then that person goes, okay, I think I'm going to talk to somebody else. Like my girlfriend saw Paul. Maybe I'll go talk to Paul. And then they make an appointment with you. And then they say this whole
Tried to see Bobby, but the 3-month wait list kind of blocked that.
I mean, we're trying to fix that.
The 1 or 2 week wait list was a lot better.
Yeah. So what do you say to them? Why is that even a thing?
Do you want the technical answer? Can I give you? Now I'm going to give you the technical answer because I'm obsessed with technical answers. So the Life Labs in BC, Canada, the Life Labs the legend underneath your result and the reference range says under 15 is diagnostic of iron deficiency. 15 to 30 is probable iron deficiency. Above 30 is unlikely iron deficiency, and 100 is normal. Square that for me. Now, under 15 is definitely a problem. Over 100 is not a problem, totally normal. But above 30 is probably not a problem. How does that how does that make any sense?
Yeah.
Patients come to me and they're like, do I look at the 100 and cry, or do I look at the 15 and celebrate because I'm a 35? How do you interpret that for patients first? And then I want to get to like the lab technicality of how those ranges are even made.
I mean, if patients want to know, I explain by saying it's a ratios game that you're more likely to be iron deficient. And the rule of iron deficiency, which is not well known in both medicine and regularly, is based on your bone marrow. So like basically the way we tell that somebody's iron deficient is whether or not your bone marrow, like this, has any iron in it. And the only way you can tell is through a biopsy. And ain't nobody gonna get a biopsy on their bone marrow because that's obviously too much. Basically, instead of digging a needle into your femur, we have approximations. And when somebody is above 15 on that ferritin cutoff, it is 100% of the time you have no iron in your bone marrow, which means you have no reserve of any kind to give your blood in case it ever needs it on a day that you went plant-based. No offense to plant-based people, it's hard to get iron. I'm vegetarian. So the second is, are there people who have some iron in their bone marrow up to a 30 ferritin? It's like, yeah, but there's a lot who don't. And there's a lot of people who feel symptoms at that point that are not explained by another condition. So then they're just like, okay, so maybe we could raise the cutoff from 15 to 30. That just kind of happened recently in a lot of places. And doctors like to obey guidelines. And until a guideline comes out that says it's now 30, they don't really like to use this oh, but like studies do say that it could be that you're tired at a 27, but well, maybe take some iron for a couple months and like, will you feel better? Like that whole thing. The third is, do people still feel symptoms? Up to like a 50 or 100. It is possible. It's probable below 50. That's why they say it's probable. It's a likelihood. It's a ratio game. It's possible up to 100. And that after 100, it's impossible. There's no way, unless you have a disease of some kind, that that is responsible for what you think is a symptom because your femur is full of iron. That's how I explain it. But like, I mean, who wants to hear that?
There's a lot of different labs in the world. There's a lot of different ways that they come up with these reference ranges. And there's clinical reference ranges and there's laboratory reference ranges. So what Bobby's pointing to is the clinical reference range of like levels of bone marrow.
Are you about
symptoms.
to put the boar in laboratory?
Yes. The laboratory reference ranges are based on when that test was initially being formulated, however many decades ago, and they collected everybody's ferritin, and then they effectively asked them, like, how symptomatic are you? And the from those, and I was reading one paper that I think it was Roche initially, where there have to be at least 60 people's worth contributing data. That's not a lot of people. You'd think these reference ranges are based on thousands and thousands of people, and they're constantly updated and they reflect the best available evidence for symptoms. They're often this nugget of just yeah, we tested a bunch of people decades ago. We got sort
We
of
have a handful of
sample.
people who showed up to the office that day.
And even then, those were 95% of presumably healthy people. In other words, that they don't have any symptoms. It's likely that a lot of the laboratory reference ranges actually included iron deficient women, so that threshold is really highly skewed to be this wide threshold. Then doctors who don't understand the difference between a lab threshold and a clinical threshold will look at that, see no bold writing, and be like, oh, therefore you're fine, even though you check all the boxes, you're not fine. And so doctors, I think, have to understand better that just because the lab threshold isn't bold doesn't mean the patient in front of you is lying or it's something else. There's a difference. And this is why, well, like Bobby was saying, the threshold got changed from 15 to 30 because of a lot of lobbying on the doctor's part to be like, hey, this lab reference range is actually inaccurate for our use, and we're the ones who are using it.
Yeah.
Hey, lab, can you please update this? And then the lab eventually comes around to be like, yeah, okay, fine, we'll update it. So it's not that that's made by doctors first and foremost based on patient samples. It's like real clinical cases. These are kind of like multi-input decisions that are very conservative, very slow. And even then, who wants to be within the 95% of normal? Wouldn't you all, and this is a question that we're going to get to, but as NDs in particular, because we're in private pay, we have the time and the ability, and patients often have the resources to seek out an optimal ferritin, not just an acceptable or not needing a transfusion level of hemoglobin or ferritin.
Also, like so many people in medicine are towing the line that if a specialist isn't going to bring this up, then why would a GP bring this up? Because that must mean that the people who are saying, because I've been in practice almost 20 years, we've been, I don't look at them. Yeah.
What's your secret?
Iron? 2 decades of my experience. I've been in the know of this, like, oh, people need more iron than what conventional medicine is saying, or what just the zeitgeist is saying that you need. And so it's been like, try to get above 100. Women are then, predominantly women, right? Are then like, oh my God, my hair stopped falling out when I got to the 100 that you said. And it's like, yeah, because you need it to be about that. And you kind of want to overshoot. And there's a reason why. Because iron deficiency can be complicated. We call it complex iron deficiency, where if a person has like, if they're a little overweight or obese, and a lot of people are, or if they have another disease, let's say they have colitis, or let's say they have rheumatoid arthritis, or even psoriasis, you can be like inflamed in a way that makes your iron act like it's inappropriately being dumped in your blood from your liver where it's stored, which then it's like a false idea of how much iron you actually have because it's just kind of being dumped as part of this like inflammation process. And then that makes your iron look even more inappropriately normal to somebody because they didn't account for the fact that you had this other.
They never tested your inflammatory markers.
No.
They're just looking for bold. They don't see bold, you're fine.
And that is another issue, that we don't do enough broad understanding of what could be influencing your iron. We're so caught up on the bullshit of black tea and coffee and red wine. We're
And
so
vitamin C even. Like,
Yeah.
you have to get vitamin
Vitamin
C.
C.
Way overblown.
Why don't
Way
you
over-
have your iron supplement with a shot of kiwi juice to finally make it work? It's like, it's not gonna work. People, having vitamin C with your iron or with your salad is not going to make that dramatic of a difference when you're hemorrhaging every month because your period is too heavy and that's why you got there. Or you have, unbeknownst to you, celiac disease or some kind of like absorption issue that doesn't allow for you to absorb anything anyway. Or you have a bacterial infection, like H. pylori, my favorite, that blocks it from actually getting into your body as well because you're not able to absorb stuff because of the impact of the infection. So like, so many different reasons that we don't investigate when a person is iron deficient, that then they're just left to float like a fatigued, floaty person in this world, figuring this is just my life. I guess this is just who I am. This is how life is meant to be. And they never actually get to realize what they're supposed to feel like or what they could have because they didn't ever feel any different. And so they don't go back to the doctor to complain again because they don't have a complaint anymore. They've just been lulled into this, I guess this is how life is supposed to be, and how ultimately horrible that we do that to people. And it's all baked in on this, like the lab stuff and like the ranges. Okay, you didn't do well on Theramax. Okay, my girlfriend did really well on Spa Tone. So then maybe I'm gonna use this like Scandinav Spa Tone.
Sounds lovely.
It's not. It's really not. It's terrible. It has no iron in it.
Put it on my eyes.
Yeah, but that's a problem. We have these people who are like, oh, I'm going to try this really great natural sourced iron that came from the glacial mountains of the
Himalayas.
Andes. And then they're just like, this is going to work for me. No, girl, the reason it's so good for your stomach and it's not going to constipate you and your girlfriend loved it so much is because there's nothing in it. There's nothing in it. There's 5 milligrams, but it's supposed to be 300
I
milligrams.
literally had a patient last week. He came in and brought me her iron pills, and it was 11 milligrams a day, and her ferritin was 14, and that's what she was given by her doctor. In that case.
Paul's favorite thing in the world is to tell people how many hamburgers they need.
You tell people milligrams, they have no idea what you're talking about.
So when you just let them know their milligrams,
yeah.
it's like, okay, talk about your burger thing.
Yeah, okay. So the average woman is made of 3,000 milligrams of iron. That's 1,500 hamburgers of total iron. A baby costs about 350 hamburgers to 500 hamburgers, depending on if you're delivering vaginally or by C-section. C-section is more, it's almost double. Each blood donation is 500 milliliters of whole blood, which is about 250 milligrams of iron, which is about 125 hamburgers, each blood donation.
Okay. Imagine every month you lose a blood donation to the toilet because you're getting
The average period blood loss is 10 hamburgers per month, which is about 20 milligrams. So that's like 5 times, but still, that's possible. That happens. Heavy menstrual bleeding, you could be losing 20, 30, 40 hamburgers a month.
Do you know how many more people have other reasons? Like you're plant-based eaters now, right? Like me. My ferritin's always around like between a 75 and 100. It just floats there. For some reason, my gut absorbs iron from my diet. My boyfriend, we have the exact same diet. We eat predominantly the same. He's the cook. So every night I get his gourmet food, and he and I should have the same ability to absorb our iron. We should have that. We don't bleed. Why would we be different? We're both men. And yet every couple of years, oh, sorry for outing you, Rob. Like every couple of years I have to measure him because I'm always still about 100 and he's a 14 or he's a 10. And then we can tell because it starts feeling things that way. Imagine adding bleeding every month on top of that. Imagine now me floating around with my hundy and now I'm having to donate blood to the garbage every month on top of that. The ditch you dig on this eventually that you can't get out of because you're so busy having an orange OJ with your spinach salad. No, like that is crazy. And like, 30 to 50% of women up to the age of 50-ish are iron deficient on some capacity.
So what's a woman to do?
So like, that's why the reason we're doing this, because it's like, it's kind of important. We ask ourselves, how is this not more screened? How is it not more understood? So then you'll come into the office and you'll say, yeah, I have joint pain. It's because I fell off a horse 15 years ago and my back has been hurting since and my hips are hurting since. I was like, that's weird. Why would like that injury cause that kind of thing to happen? Or you'll say, I'm just frozen all the time, but that's just because I'm a girl and that's what girls are. We're just frigid. And then you're like, really? I didn't know that was true. And then you say, like, what was your last iron? And you're like, oh, that was checked 5 years ago. It's always been fine. I don't have to worry about that. We measure it and it's in the pits. It's in the pits from any angle that you look at it, from any threshold. Or my classic example nowadays is women in perimenopause. Women in perimenopause are getting really weird periods. They're irregular. They're heavy. They're clotty. You have fibroids. You're way more likely to have like different cycles that make you lose more iron. So it's like this perfect opportunity for you to blame some other hormonal issue. It's my hormones, you guys. Like, test my hormones. And then you're just like, can we make sure that your iron is okay? And most women are just like, what are you talking about? That was tested 5 years ago, so I'm fine. Let me just humor me. Let me just take your blood a little bit more, a little bit more of a sample of your blood, and then we'll take it. And it's how often is it in the pits?
Yeah.
All the time,
Yeah.
all the time. And then you fix that. We are an infuser group. We love infusing iron to get rid of it as a problem. Just get rid of it as a problem. Just remove it. And then within a month, you'll be like, all the things that you blamed, it was my hormones, you guys. Or like all the things you blamed were on the horseback accident, or all the things you blamed on being just a woman. They go away. And then you have this new crazy understanding of like, Jesus Christ, that was all iron the entire time, but nobody bothered. It's unhinged. Paul, how many problems could we solve by ultimately a single infusion of iron?
So much. It's a mineral. How are you going to out coffee or out sleep a mineral deficiency? We have an amazing resource about this called ironrxuniverse.com. We'll put it in the show notes. ironrxuniverse.com.
That was such a podcast thing to say.
Yeah.
We'll put it in the show notes.
I just watched it.
I know.
If I would watch the podcast, I would want the show notes. So anyway, it's in the show notes. So go to it, take a look. But on the IV iron page of that website, you'll see a video. Watch that first video, the first 15 minutes. Inside it, you'll see a graphic about all the symptoms that start to pile up the lower your ferritin gets below 100. So in order, if your ferritin is like a 75 and below, you run into fatigue, insomnia, anxiety, depression. Actually, restless legs was one of the earlier ones too. Restless legs at a ferritin of 75 should actually be brought up to 100 or 150 to see if it goes away. Fatigue is really common at a ferritin, even upper double-digit ferritin.
We've had people with a ferritin of 65, and we give them an infusion. We'll give them an infusion. Like, we won't get into the nuances of what we do there.
How much, or
yeah, we'll give them an infusion, and they come back, and you can placebo Domingo this all you like, but that's not what is happening. They'll come back and say, "You changed my life. You changed my life. I didn't even realize what I was feeling before. You changed my life. My hair, like the hair thing is like a ferritin of 40-ish. There's
libido is ferritin of 50 or less. How many divorces have happened because of iron deficiency? Because you look at your partner and you're like, I just couldn't. You're iron deficient. Of course, evolution shutting down your libido.
And what are we doing? Like, all the medications for a person's libido are to get more blood to our parts. Like, we're getting more blood to our parts.
Let alone the neurotransmitters. You need iron to produce dopamine.
How is that going to work for like your desire, right? Your drive. But how is trying to take a drug to make more blood get to your bits, especially like the lady bits, when the oxygen is the point? Circulation is to bring flow of oxygen to your tissues. You can't bring flow of oxygen to tissues without any iron, because that's what it's carried on.
And hemoglobin carries it in the blood, but myoglobin catches it in the muscle. And so you could have normal hemoglobin. It doesn't mean that you have enough for the cytochromes in your brain or the myoglobin levels in your muscles. But meanwhile, you look at your hemoglobin, your doctor looks at their hemoglobin, they're like, what are these gravity guys talking about? Of course you have enough oxygen in your blood. What about your muscles? What about for all the jobs needed by iron in the brain?
Yeah. And they will say that we big up iron infusions because we own iron infusion clinics.
Let's talk about this.
That's so crazy to me. If it isn't the people who figured it out who start offering the service, who is it?
Mm.
If it isn't the people who are like, this is a problem, but nobody else is doing this, hospitals don't give a like, nobody cares. That's the problem in the first place. Are we supposed to sit on our hands?
And we can't afford it.
Yeah. Are we supposed to sit on our hands and be like, let's just wait until somebody else offers this and then not charge a person for it?
Mm.
Are you joking?
Mhm.
No, we're like, we're going to offer a service. And yes, it's private pay medicine, but that's the whole point. We're offering a way out so that the system doesn't have to feel this like enormous burden of infusing millions of women through a hospital system that already can't handle it.
Mhm.
Like, we're not supposed to add more to GPs plates. We're not supposed to add more to the conventional systems plate. We're supposed to try to take it away. That's like one of our jobs.
That's why we've got the scope that we've got in
totally.
BC, because BC, a fifth of British Columbians don't have a doctor. So you step in and, okay, great, we'll take it from here.
And we live in Shangri-La. Like, we live in Vancouver.
Yeah.
We live in Shangri-La, for God's sakes. Imagine what it's like in the rest of the world. Never mind what's happening in places where there's predominant vegetarian populations. India, South Asia, big populations of Black and brown women in areas around the city where there's a more predominant population that doesn't get screened because this problem still exists, but they need to be screened even more. It's just, it's wild. So we offer the service because it's so important, and we try to get other people to start offering the service. So we trained almost 200 doctors and other providers, 200 almost. To try to
From the Caribbean to the UK. Anyway, we'll talk about that another time. We'll talk to the doctors another time, but back to patients. So patients have the option of oral iron, and when it doesn't work, then they seek us out maybe for an IV.
The other thing I wanted to bring up was the whole point of taking oral iron before you get an infusion. That blows my mind. That we force people to take one of the most ineffective ways of overcoming your deficiency that is super we'll blame all kinds of herbs for their side effects, but we will turn the other cheek for iron every time. Bloats the shit out of you. It hits the shit out of you. You can't take a shit. You are in pain. You get hemorrhoids. You can get fissures that make you bleed more as a result of the constipation it caused.
And yet, despite all of those, you need to fail oral iron before you're offered an IV. And even then, in Canada, only if you're anemic, which is another thing we got to talk about, because nobody really properly understands the difference between anemia and iron deficiency. Yes, iron deficiency, anemia is a thing. Anemia means it's the last stage. It's the final stage. If you don't have anemia, you can still be iron deficient.
Who wants the last stage of anything?
Anemic.
Who wants stage 4 of anything?
Exactly. So just because you're not anemic, that doesn't mean you're fine. Your ferritin should be 100.
What if we made it go away? Like athletes, all the turkey trotters that were outside today, 20-30% of them are iron deficient, wearing their little turkey outfits. Gobble, gobble. And they're still plugging along, being like, I'm doing great. Well, you could do so much better. Like, as an athlete, there's so many athletes out there who also, how many gold medalists have you infused so that they could get a gold medal?
Lots in Yukon, and needing to fail oral iron in order to get the IV.
It just pisses us off because why are we doing that to people? You're spending money every month, $50, $60 on a high absorption iron that you're now taking every second day because every day apparently wasn't very good to absorb and it caused more side effects. So take it every second day. Okay, commit that to memory. And then do 3 months of it. Nobody retests you because nobody bothers.
That's the thing. Years later, somebody will be like, I was told I needed iron years ago. Well, did you ever check? Did you fix it?
Took it for 3 months.
No, I still have the symptoms.
There's a clear issue. There's a flaw in this thing that we created, that first line therapy is oral. I get it. If you don't have access to infusions, that's all you have as your option.
Or if your ferritin's 80,
great.
Take oral, bump it up a little bit.
Yeah. But if that's the only option available to you, I would suggest that you push your doctors to offer you infusions, even if you aren't in a place that readily offers them like we have, or you find somebody who does, pay for it privately because it's going to change your life. And we need to really make iron infusions first line. We have to stop making it the second thing. Pregnancy, where you're infusing pregnant women who are on top of their pregnancy, that's stealing the shit out of their iron. The baby is an iron just sieve, and it's just not impossible. It's literally impossible after week 30 to get back to non-iron deficiency when you've been iron deficient. Impossible. You can't. The loss that you're getting from week 30 onwards,
Like 7 milligrams a day,
ladies,
baby is taking. You can't do that with oral iron. You're not gonna make up for what you lost and
Fact.
overcome that.
That's a fact. And yet we're still like, take oral iron. And if you bleed out in your delivery, or if you have a C-section and you lose that much blood, you'll take iron after the delivery when you're already
Postpartum is then a thing.
My God, this is crazy that we're already putting a burden on top of already burdened people. That is, it's unacceptable, actually. So, which is why we're so impassioned by this, which is why I think it's so important for people to like know this kind of stuff.
Let's talk about cost, because when you say private pay, people immediately assume like, I can't afford that. If you have benefits, God, it's a shoe-in. It's a total shoe-in. The vast majority of benefits programs cover either the whole thing or the majority of it. And iron is expensive, not as expensive as burgers. I like to compare this to burgers when somebody's like, oh my God, that costs a lot. For a 1,000 milligram dose, which is 500 hamburgers worth of iron, the iron drug itself costs about $550. That's $1.10 per burger. You think that you're going to get any better deal than that anywhere? But let alone, even if you had to pay for that out of pocket, $550 or whatever out of pocket, insurance usually covers either the whole thing or like 50 to 80% of that. You're getting it for 50 cents a burger. You're going to beat that in any other means? Like, no. So the cost, don't think about the cost. Also, the lost productivity, right? You take oral iron supplements, nobody's going to pay you back if they're not covered by drug benefits. You have to retest 6 months later. You lost 6 months worth of spending on coffee, sleeping in, snoozing, missing
This is your life. This is your life. This is your life.
You're not going to pay $1 a burger.
And just because the system doesn't emphasize this doesn't mean it's not a big deal. It's a huge
because
deal.
somebody's MD didn't say it, because the reference range, because of economics, because of all the other variables. If an MD didn't say it, it's not real or it doesn't exist. Look at the literature on our website, ironorxuniverse.com/ they'll go to the For Doctors page. We'll put the link down there.
Okay,
if you're a doctor listening to this, read that whole page and come up with rebuttals. We're open to learn. We want to learn. We want to be called on our check out the resources there, because this is in plain sight. We've known about this for years. We've been offering iron infusions. We're training doctors. We have this conversation on a daily basis.
We're gonna have to do a whole nother podcast episode on infusions, like side effects and stuff like that. Unless today is just about get tested, know your number, don't ignore the number, ask for it, and then fix it. Just fix it.